Good morning. This is Megan Renahan with the Batesville School District, and it is time for the Pioneer Update. The Pioneer Update is brought to you by Citizens Bank. Citizens Bank is a bank that puts their people first, and that's wonderful because at the Batesville School District, we are all about putting our students first. This morning, I have Miss Candace Martin and Laura Morgado. They are with our home visiting team. Thank you both so much for joining us today.
Thank you.
Thank you.
Yes, we're so excited to have you, mostly because y'all applied and worked so hard for a grant, and that grant is Investing in the Power of Families. So tell us a little bit about that grant.
Well, this grant we applied for back in early November. Parents as Teachers, the National Center, offered it for affiliates in 5 countries, and we were actually one of 62 that were awarded out of 240 total that applied for it. So we're really excited. Our local program, we're going to work on adding lactation counselors to our program with our home visitors.
Yes, so we can assist them and guide them better in their home language because we know it's vital to the success of breastfeeding.
That will give 9 of our home visitors in our Parents as Teachers office certifications to be certified lactation counselors and work with our families on our home visits. We got lots of support with our local gynecologist, GYNs.
Yes, like Dr. Glasgow was one of the ones who helped us out with the letter of support. Save the Children, the health department was another one that really helped us to make this happen.
That is wonderful. And then what is that grant amount that y'all will get to utilize?
We actually get $50,000 to help train our home visitors and help do group meetings and things to help connect with our families in our program.
Right. Well, and whenever we have staff that's empowered and they have those tools and resources, that only means that we're better equipped to help train our families. And we really want to get that infant mortality rate down because, as you know, and that's what y'all preach all the time, that is what we're number one and known for in the state of Arkansas is our infant mortality rate. Tell me a little bit more about this idea y'all have of maybe some small, intimate groups with those moms. So what are y'all wanting to do to help support them?
Well, we really want to be there from, with breastfeeding since the beginning because we work with them, prenatally. So we want to be there to support. Personally, I just had a baby and they didn't have lactation consultants in Spanish. So I feel like now that half of us is, bilingual, we're going to be able to help them, with the process of breastfeeding, and that will be, successful for them and beneficial for the babies too.
Yes, absolutely. Because, when we know better, we do better.
Yes.
And that's what that opportunity is going to allow to us. And that was a huge part of that grant application whenever y'all were filling that out, making sure that things were going to be available to all of our families and being inclusive. And when we look at our demographics of our school district, we have about 30% of our population is Hispanic.
Yeah.
And that's a very large portion. So reaching that audience and making sure that those moms feel supported and like they have someone that they can comfortably communicate with and ask questions. Because like I said, when you know better, you do better. And we want to give them the best information because when mom's healthy and feels empowered, that means that baby's going to be in a healthy environment and thriving not only at school but also at home.
Yes, and we're actually going to be the first Spanish-speaking lactation consultant in Independence County, so that is also awesome because there's going to be 5 of us now able to help the community.
That is wonderful and such a great thing. I know that has to make you feel good as a mother yourself to be able to support your fellow mamas in the community in that capacity.
Yes, actually, I just attended the National Week of Breastfeeding to the health department as a guest speaker and went there, and it was shocking to me that it was only 6 that were fully breastfeeding, and a lot of that it has to do because sometimes there's not the support that they need. So maybe this will maybe change the game, and maybe more people will be willing to try breastfeeding now that they know that they have the support. And we're going to have, with this grant, we're going to have materials and supplies that can help with that too.
I love that. Well, Laura, one of the things I always admire and love saying is that as pioneers, we're constantly pioneering and blazing the trail in new ways that we never thought possible. So in your role, did you ever think that you'd have the opportunity to do something like this?
No, not really.
Yeah. And Candace, again, great leadership. You always do such a fantastic job getting out of your comfort zone today, of course. You and Laura have just done such a great job of helping to bring this grant into fruition. $50,000 is going to be put to good use. So I'm excited to see all the great things that y'all do to help support our families.
Thank you.
Awesome. Well, thank you so much for coming by. And as we always like to say, it's a great day to be a pioneer.